Hi everybody, welcome to today's webinar. Sorry that we're starting a couple of minutes late. We just had a couple of issues getting going, but we're here now. Welcome everyone. I'm Anna from the TUC and I'm joined by my colleagues Quinn and Sian, and I'll be handing over to them in a second. Just a bit of housekeeping before we get going. We do have live captions on this webinar. There's a green button underneath us. If you click that, the webinar will open in a new screen with the subtitles. But if you do that, please remember to close this original screen so that you don't get an echo while you're watching the webinar with the captions. This is a TUC event like all others, so we will we still have the same code of conduct that we would have for a live event, and my colleagues will just be posting that code of conduct in the chat panel in a few seconds. So as you've seen, there is a chat panel on the webinar, and it's great to see so many of you already introducing yourselves or telling us where you're from, and please use it to exchange tips and ideas with each other. We will also post resources and links there that are mentioned throughout the webinar. There's an ask a question panel below us here. Please post a question there for Quinn or for Sian. We will try to answer as many questions as we can, but we might not be able to get to them all in case because of timing, and we'll try and answer questions that are quite general. We won't be able to answer very specific workplace issues on a webinar like this. So on with the substance of today. So we all know that coronavirus has affected everybody over the past 6.5 months now. It's affected everybody's lives in ways we probably couldn't imagine. But today we're going to focus on how COVID-19 has particularly affected disabled workers and women workers. And we'll be hearing first from Sian to talk about how it has affected women workers and crucially what workplace reps can do to support these colleagues. So Sian, I'm handing over to you.
Thank you very much, Anna, and thank you everybody for joining us today. I can see that there's 326 of you, and it's absolutely amazing to see that you all are here, and I hope that we can help. But I think that the number of you on this call also are testament to the issues that we are already seeing in the workplace. Exactly as Anna said, COVID has had a huge impact on everybody, but it has had an unequal impact. It has worsened the existing inequalities experienced by women, by disabled workers, by LGBT, Black and minoritized workers. And it's really laid bare the gender inequities in our society, particularly for women with multiple and intersecting identities, disabled women, Black women, LGBT plus women. And women workers have been acutely impacted since the crisis began. They make up the majority of workers that have been in the most high-risk public-facing jobs, such as women working in the health and social care sector, or as cleaners in our hospitals, as carers in our shops and in our schools. Many of those women are working for poverty pay in insecure forms of work. So of the 3 million workers that are working in really key essential roles at the outbreak of the crisis during lockdown, 1 million of them on the lowest pay, 98% were women. And many of them are working without the vital rights and protections needed during a crisis like this, namely statutory sick pay. And while it was a terrific union win really early on in the crisis, we got the government to move statutory sick pay from something that came in after 4 days to a day one right. But the threshold still excludes low-paid part-time workers, the majority of whom are women. So 2 million workers miss out on statutory sick pay, and 70% of those are women. But not only are women working in high-risk public-facing jobs, they are also disproportionately the ones who have been working in shutdown sectors like leisure and hospitality and the beauty industry. And we've just been starting to see some of those industries start to reopen, move towards some form of reopening, and then announcements today and then the last week look set to really put paid to some of that and put those jobs in real jeopardy. The pandemic has also intensified existing barriers to economic justice that women faced, like wage discrimination, sexual harassment and violence, and the lack of affordable, flexible childcare. And I'll come on to that in a bit more detail in a moment. But we've also seen a shocking rise in domestic abuse. At least 16 women have been tragically killed in domestic abuse related incidents since the crisis began. It's more than triple what we normally see year on year in terms of domestic abuse. And we know there's been a 150% increase in the visits to the National Domestic Abuse Helpline's website and around an 80% in calls. As women and as all workers, because domestic abuse can happen to anyone, while it is disproportionately women that are affected, and particularly by the most severe and serious forms of domestic abuse, what we're seeing is that the workplace has become the home for many, and for many the home has become the workplace, and people have been cut off and isolated from support networks, from others that may have been able to help spot signs of domestic abuse and stop it. And that's led to many women being in much more vulnerable situations. And I will post a link in a moment. I came on a few months ago and talked about the toolkit that we developed at the TUC for how employers, managers, and particularly trade union reps can support their colleagues and members who they think might be at risk of or experiencing domestic abuse. But what we cannot afford to see, and what we are worried that we're starting to see, is a real rollback on women's hard-won rights, on the progress that we have made towards gender equality in the workplace. During the pandemic, women bore the weight of most of the unpaid care and domestic work in our homes, and now they're making up the majority of those who have lost jobs or hours at work. Older women workers are the fastest growing economically inactive group. And what we think that is a result of is the explosion in additional care needs and the lack of care services that have been able to meet that. We've seen some social services having to close or reduce their offerings. And it's been predominantly women, particularly older women, who have had to step in and meet that unmet care need. And what's happening is they're having to either leave work entirely or reduce hours, because a lack of flexible work means they can't balance those work and care commitments. And what we're also seeing last week, new figures from ONS showed a 79% increase in redundancies among women. It's the record breaking. We've never seen such a rise year on year in terms of redundancies. And that compares to a rise, still worrying, but of 23% among men. So we can really see that the economic impact of this crisis is disproportionately affecting women's jobs, women's pay, and women's economic security. And the reason I want to talk a little bit more about redundancies is because we know that employers, as the job retention scheme draws to a close potentially next month, it's currently scheduled to, even though TUC are lobbying hard for it to be extended. We know that employers must, under Section 188 of the Trade Union and Labour Relations Act, they must consult if they are planning to make redundancies. Where there are 20 to 99 employees possibly affected, the process must begin at least 30 days before the first dismissal. If there are more than 100 employees going to be affected, they have to give notice of at least 45 days. And in cases where fewer than 20 employees are at risk, there is still a duty for them to consult with employees and, crucially, with trade union reps. Failure to properly consult with someone before making them redundant means the chance of them bringing a claim for unfair dismissal at an employment tribunal makes it all the more possible, provided they have been working for that employer for at least 2 years. In addition to completing a proper consultation, any redundancy process must make sure that it is not marred by unlawful discrimination. Even in cases where an employee has less than 2 years of service, and so they're not required to go through a formal redundancy process, a decision that employer makes to dismiss them could still be unlawful if it is tainted with discrimination. And I thought it might be helpful just to give a reminder that the protected characteristics that the Equality Act 2010 makes unlawful discrimination. Those protected characteristics are age, disability, gender reassignment, marriage and civil partnership, pregnancy and maternity, race, religion or belief, sex, and sexual orientation. Now, as many of you will know, discrimination can come in various forms. The simplest is direct discrimination, and that would come under Section 13 of the Equality Act. And direct discrimination is just where someone with a particular protected characteristic is treated less favourably than someone without. So in a redundancy context, this might mean making a disabled or pregnant woman redundant simply because they are disabled or because she is pregnant. Now, we hope that most employers will not engage in that kind of discrimination openly. It's likely that if a protected characteristic is the reason for someone's dismissal, efforts will be made to hide that and to suggest that there is another reason. And so as such, any potential claim will depend on what evidence can be gathered. And that's where trade union reps can play a real key role. Is it possible to show that an employer has only selected disabled people for a redundancy without them being able to give a good reason why? Is it possible to show that they've only made pregnant women or those on maternity leave redundant without having a good reason why? Have any emails been found that could show a manager is deciding they don't want to keep employing someone who's about to go on maternity leave? And even in a redundancy process where an employer thinks they're acting completely lawfully, discrimination might and can still creep in. If an individual is assessed in a manner which, although applied equally to everyone in their redundancy pool, puts those that share one of the protected characteristics at a particular disadvantage, then the employer will have to show that their assessment criteria is a proportionate means of achieving a legitimate aim. And I'll explain what I mean in a moment. And that's because otherwise it could amount to indirect discrimination, which is made unlawful by Section 19 of the Equality Act 2010. I wanted to give an example here around working mums and working parents in general, but in particular around working mums, because TUC's research has found that 2 in 5 working mums with children under the age of 10 cannot get the full childcare they need to cover hours at work because of the ongoing crisis that we're seeing within childcare and education, where we're seeing rolling school closures, where we're seeing bubbles and self-isolation, where nurseries and early years settings aren't being able to offer all of their places that they normally would. Many are running at about 37% of pre-COVID capacity in order to comply with social distancing measures. And that's creating a huge issue for working parents because they cannot get the childcare they need, and they can't turn to grandparents who before would have been able to step in and help with some of those childcare needs because of the risk it puts them at of contracting the virus. What we know is that if an employer is taking, say, performance or attendance into its redundancy selection criteria, then if working mums who are trying to balance work and care and are having to reduce their hours or take unpaid leave in order to balance those work and childcare commitments, then if an employer takes attendance into account, they could disproportionately make working mums redundant and those with caring commitments, and that could mean they fall foul of the equality law and be open to an indirect discrimination case because they are not taking into account the particular needs that are occurring for that group with protected characteristics. And there's a really clear step here and a role that trade union reps can play. Are you asking and can you ask your employer to map out any planned redundancies? Can you spot any patterns within that mapping out of the demographics? Are disabled workers, are working mums, are pregnant staff, are they appearing more than they should be disproportionately in that redundancy mapping process? And if so, it can be a really good point to challenge and start a conversation. Another common example of indirect discrimination in a redundancy is a last in, first out policy of making redundant those employees who most recently joined the company. While that may at first seem fair, it actually puts younger people at a disadvantage, as they necessarily will not have had the opportunity to build up a longer period of service with the employer. And as such, any employer would need a particularly good reason to show why such a policy is necessary for them to be able to implement it lawfully. Another example could be where an employer decides to only keep employees who have a 100% attendance record. As I said, that could affect working mums struggling with childcare difficulties as a result of COVID, but it could also put disabled members of staff at a particular disadvantage. And so that policy would not seem a proportionate means to an end. Also, really important again for women, the part-time workers regulations of 2000 provide additional specific protection for part-time workers. And it's really important for women because over 3.4 million women work part-time compared to around 700,000 men. If someone can establish that they have been selected for redundancy because they are working part-time and a comparable full-time worker was not, then that will make their dismissal automatically unfair unless it can be justified on objective grounds. And so redundancy decisions which take into account factors linked to part-time working may also be indirectly discriminatory on the grounds of sex because, as I said, women are much more likely to work part-time, and that's connected to the unequal distribution of care responsibilities and that women disproportionately pick up that burden. I also wanted to mention redundancy around pregnancy and maternity because we are seeing an alarming rise in discrimination against pregnant women. Prior to the COVID-19 crisis, research by the EHRC found that 54,000 women a year are forced out of their job as a result of pregnancy and maternity discrimination. And we at the TUC did some research early on into the crisis because we knew this was going to be an area where we were expecting discrimination and difficulties to be occurring. And we found that 1 in 4 pregnant women said they had been treated unfairly or discriminated at work since the crisis began. And that included being singled out for furlough and for redundancy as a result of their pregnancy or as a result of being on maternity leave. And in as yet unpublished data, we actually found that disabled mums said they were twice as likely to have been singled out for redundancy compared to able-bodied mums. So we know that, again, those intersecting identities that women and all workers have can put them at much higher risk of unfair treatment and at risk of redundancy. Now, Regulation 10 of the Maternity and Paternity Regulations 1999 affords special protection to employees who are made redundant during their maternity leave. Those employees are entitled to be offered, before the end of their employment and before any other worker, alternative employment with the employer, its successor, or any associated employer. That's provided that there is a suitable alternative vacancy, one that is appropriate, but they have a right to that first refusal. And it's really important that employers comply with that law and make sure they are not treating a pregnant member of staff or one who's on maternity leave less favourably than anyone else, and that they're not making them redundant or dismissing them as a result of maternity leave or pregnancy, in which case they're opening themselves up immediately to a direct discrimination claim. And this is where, again, trade union reps can play a really important and vital role, because we can ensure that employers are using a fair selection process to decide who to make redundant. That process must be transparent, it must be objective, and it must be measurable. And typical criteria for that can include individual skills and qualifications, performance or aptitude at work, attendance and absence, disciplinary records, and customer feedback where there is any. But again, I must warn that if an employer decides to use performance as one of their selection criteria, they must ensure it does not disadvantage anyone with protected characteristics. So pregnant employees, those on maternity leave, the disabled workers or those who have caring commitments. For example, if the last performance assessment was done during pregnancy and maternity leave and showed lower scores than usual as a result of that pregnancy or maternity leave, that must not be taken into consideration when going through the selection criteria. If an employee missed the poor performance review cycle because of pregnancy-related illness or because of maternity leave, then it's good practice to consider using a previous review and awarding the same score unless there is a good reason unrelated to a woman's pregnancy for giving a different score. Failure to do that would be disadvantaging her as a result of her pregnancy and maternity. And just before I wrap up, I wanted to mention time limits. So if a worker believes they have been treated discriminatorily or even just unreasonably when being made redundant, they have the opportunity to bring a claim to the employment tribunal supported by their union. But what's really important here that we get across to workers and members is that the time limit for claims is short. For redundancy cases, a claim will typically have to be started within 3 months of dismissal. Claimants will have to go through the ACAS conciliation service before a claim can be brought. And so it's really important that we make sure that everybody is aware of that time limit. And the role that we can play as trade union reps and as trade unions is making sure our members are aware of their rights, they're aware of the time limits, they're aware of those protected characteristics. Can we hold a meeting if there are consultations going on where we disseminate that information amongst members? Can we produce a flyer or circulate an email with some of that vital information? And an important point to think about there is how are you communicating with members who may be on maternity leave or may work part-time and may miss some of the meetings that you're holding. Really important to make sure they're included in that information. I think that is everything from me. Really happy to take any questions or comments once Quinn has finished his section. Thanks, Anna.
Thanks, Sian, and thanks for so much in the way of helpful advice for reps who might be dealing with this situation in their workplace. I think especially the things about remembering to include people in communications. You know, if someone's not there, I know lots of us aren't there at the moment, but if someone is on maternity leave, it's always important to include them. So I'm going to hand over to Quinn now to talk about how COVID-19 has disproportionately affected workers with disabilities and how workplace reps can help support these colleagues before we look at some of the questions that have been posted for both Sian and Quinn. So Quinn, over to you.
Thank you very much, Anna, and thank you, Sian. That was a really fantastic presentation. So when I said I would do this, I was really excited, and I'm still really excited. But then I didn't even know where to start. This is such a big and important topic, and there's so much, it's so much wider than the world of work. And to say that COVID-19 has impacted disproportionately on disabled workers is to make an extreme understatement. So the Office of National Statistics on Friday let us know that 59% of all COVID-related 19 deaths were disabled people. So disabled people make up around a fifth of the population, but we're 3/5 of COVID-19 related deaths. So the impact has been huge. And I'm here speaking to you as a policy officer for this area and as a disabled member. And what I'm going to do is I'm going to tell you what the TUC has been told and the intelligence gathering that we've had. So we've heard from disabled members and affiliated unions. I'm going to relate that to you. But I want to be clear that the best way to understand the barriers that your disabled members are facing in your workplace is to talk to them directly. So at the TUC, we've adopted the social model of disability, which says the best way to ensure disabled people can participate is by removing the barriers that they face. And that informs all of the work we do. So my work is grounded in it. But if you want to learn more about the social model, what I'll do later on is I'll post a link to some micro-learning we've done. I also wanted to point out that the TUC's affiliates represent 5.5 million workers. And when you kind of look at who they are, that's around 1 million disabled workers. And I just point that out to say that we take this very seriously. And really what I want to do is talk about the workplace, but I feel it's so important to understand the wider impact that I'm going to explain some of the wider context of what's happening right now. So the first thing I'll point out is that the government passed the Coronavirus Act 2020. And what that did is it brought in emergency powers. And specifically, we have concerns about those powers because, one, it suspends duties within the CARE Act, particularly the duty to assess needs in accordance with people's requirements. And so we're worried about the lack of care being provided. It also suspended some parts of the Mental Health Act. And specifically, the concern there is that in order to detain a person under that act, used to require 2 doctors, but during this period requires 1. So there are safeguarding issues in place. And what we know is that mental ill health has been exacerbated during the pandemic. And so those with the highest level of mental distress pre-crisis are now facing some of the greatest challenges. We also know that before COVID-19 came in, benefit cuts and austerity had already hit disabled people the hardest. So changes to the welfare system over the past 10 years have left disabled adults 4 times worse off financially than non-disabled adults. And so our position, the TUC's position, is that universal credit is not fit for purpose and it should be stopped and scrapped. But during the pandemic, when it was been the only vehicle for delivering this benefit, what we have said is that conditionality and sanctions must be ended. So that continues to be disproportionately impacting on disabled adults and disabled workers. Now, also in the wider context, we've talked about PPE, personal protective equipment. And what we know is that there has been a drastic shortage of PPE, absolutely. But we also know that disabled people haven't been able to get a hold of it. And when they have got a hold of PPE, it often hasn't fit properly or worked appropriately. So within the context of this entire pandemic, there is the fact that disabled people couldn't get it. And when they did get it, it didn't work. And that continues to be an issue. Now, when we look at employment, what we've done is we've looked at and analyzed the 2008 recession to find out what happened to disabled workers then, so we can project what's going to happen as we go into recession now, and we can start putting in place steps to prevent any negative outcomes. And what we found was that actually disabled workers were the first to be made redundant and the last to be reemployed. And while in work, they had negative experiences like changes to their terms and conditions, changes to work practices, wage freezes, reduced overtime. And so we see and we can tell that coming down the line as a result of COVID-19 are going to be a number of issues specifically for disabled workers. Now, I'm greatly concerned by the fact that in the last recession, disabled workers were the first to be made redundant. And that's particularly because we already know that disabled workers face an employment gap. So disabled workers are roughly 51% employed. Disabled people in work, roughly 51%. Non-disabled people, 80%. So there's an employment gap of 30%, and it's just not reducing. And so to think that that gap could increase because of the recession is really disheartening. We also know that disabled workers have and experience a pay gap. So the pay gap for disabled workers is 15.5%, and that kind of means nothing to most people, but roughly it equates to £1.65 an hour, or equates to earning £3,000 less a year. So also, we know going into the recession that disabled people are already being paid less. So we've got to look at how we can address that going forward to try and make sure that these gaps don't increase. So those are some of my real concerns. And just to dovetail on what Sian was saying earlier, when we think intersectionally, when we look at the pay gap for disabled women, what we find out is that they earn 25.9% less than non-disabled men. So it does vary by intersectional characteristics. I wish that I could tell you what the BME / disabled person pay gap was, but unfortunately to get this information, you analyze the labor force survey, and it just doesn't give us the statistics to do that. But the TUC, we are calling for disability pay gap reporting, and I'll talk to you more about what you can do in your workplace in advance of that legislation coming into place to get your employer to be thinking about what they can do more. Now, it won't surprise anyone on this call that one of the big things that are happening right now is around reasonable adjustments, and reasonable adjustments not being put in place. So all employers have a legal duty under the Equality Act to proactively make reasonable adjustments to reduce, remove, and prevent any disadvantage that disabled workers face. And despite having this legislation in one form or another in place for over 25 years, our members tell us that one of the biggest barriers that they face is that their employers are not putting in place their reasonable adjustments. And this has continued throughout the pandemic. A recent Unison survey found, for example, that 50% of respondents face barriers to doing their jobs that could be removed through reasonable adjustments. And of those who requested adjustments to be put in place, 67% had some or all refused. So we see it's still an ongoing and massive issue. And 23% who had requested an adjustment had waited a year or more to receive what they needed. So if we look in the new world of work that we found ourselves in, which is that roughly 45% of people have worked at home or are working at home, for what we know is that disabled workers, a lot of them are working in non-optimal conditions. So they're working without their adjustments. And they did that, and they started that because they thought, okay, there's a pandemic. I'm going to help my employer. I need to kind of keep working as well as I can. But actually, it means that they don't have the adjustments they need in place, and they've continued to not have them for 7 months. And in the best of times, a quarter of disabled workers wait for longer than a year to get them. And that's just not good enough. It's just simply not good enough. But while we're talking about reasonable adjustments, it's also important to think about one of them that disabled workers have been denied for years, which suddenly became one of the only ways people could work, and that is home working. So what we know is that around 45% of the population worked from home. And some recent surveys found that 50% of disabled workers work from home all or some of the time during the pandemic. And of them, 73% said that they were more productive when working from home. And we asked them why. And the reasons they gave was because they had reduced impact on pain and fatigue, less commuting, and the ability to work more flexibly and take additional breaks where needed. So actually, working from home has been a great vehicle for some disabled workers. We wouldn't say that all disabled workers must or should work from home, but we think that those disabled workers who have worked from home during the pandemic and want to continue should legally be entitled to. And that's a recommendation that the TUC has made, that Unison have made. It is not the law, but we think that it's something that should be brought into the law. Now, earlier, Sian, she made a really great intervention where she talked about redundancies and protections people have, and I'm not going to kind of go over that. I will just say two things. One, I know there's going to be some new guidance coming out from the TUC on this area. And the other thing to keep in mind when thinking about disabled workers is that employers are obliged to make reasonable adjustments to a redundancy process to ensure their disabled employees are not put at a disadvantage because of their disability. And so as a rep, what really I'm saying is that you need to remember that in cases of disabled members where employers fail to make a reasonable adjustment, including adjustments to the criteria they're using and the procedures, is possibly a form of unlawful discrimination, and you should bring that to their attention. So kind of the real question here that I've kind of been avoiding but wanted to really talk to you about is what can reps do going forward, knowing these issues exist to protect disabled workers and their jobs. So I think it's important that you ensure disabled members are getting the reasonable adjustments they need put in place and put in place quickly. And one way to ensure you're doing that is to make sure you talk to your members so you know what their difficulties are. One of the things we're told that is also incredibly frustrating for our members is that they request a reasonable adjustment, they finally get it put in place, their line manager changes, and they have to renegotiate all of the adjustments again. So one of the things that the TUC have done is we've produced a reasonable adjustments disability passport. And what that does is it just helps to record all the agreements around adjustments that are in place. So when the new manager comes in, you don't have to start from scratch. You can just hand over what's been agreed and they can continue to exist. And there should be a link going into the chat now to that document. It's very helpful. I mentioned it a second ago, but ensuring in a redundancy situation, employers put in place adjustments to the selection criteria and the processes is very important. And what I wanted to spend a little bit of time on was about disability employment and pay gap reporting. So it's not the law, but we think it's important. And we think that employers can and should do more in advance of the law to be reporting on their gaps. And it would be really great if reps could help negotiate for them to start doing that now. The legislation will happen at some point, and I will make it happen, but we shouldn't wait for that. So if reps are negotiating with employers for this, what we would suggest they are saying is that employers should collect and publish disability pay gap data in a similar manner to the gender pay gap reporting, including the proportion of disabled people in each pay quarter. They should collect data from disabled workers and job applicants in areas specifically including recruitment and promotion, pay and remuneration, training, appraisals, grievances, disciplinary action, and dismissals, and other reasons for leaving. And they should use that information to inform and create targeted action plans. So one of the things we all know is that pay gap reporting isn't worth anything if it's not accompanied by an action plan. And that action plan can't be secret, it's got to be public, and in a place where both staff and external people considering working for your employer can see it and make an informed decision on what they do. So that's the end goal. So if you do manage to negotiate with your employer to do disability pay gap reporting, it's the action plan that we really want to see put in place. And in it, they should set targets for improving disabled workers' representation at all levels of the organization, and set measures to report against those targets annually. So those are just some of the kind of things I wanted to talk to you about today. And that's I'm going to end that there. So thank you very much.
Thank you, Quinn, for some really helpful advice there and tips for people who might be supporting colleagues who have disabilities in the workplace. You've even managed to sort of preempt some of the questions, and you've answered one or two already that have come in about reasonable adjustment passports. Actually, someone asked if there was going to be a push to use those, so you've kind of covered that already. Keep your questions coming. I am keeping an eye on them. So the first one that I am going to pick out is for Sian. So the question asks, it doesn't specifically reference women workers, but it does reference carers with young age children, which you did touch on a little bit. So it asks, is there any policy for carers with young age children who might be facing difficulties to work from home, and that they've not had any adjustments made by their employers? Is that something you can offer any advice on, please, Sian?
Oh, sorry, I unmuted myself. Yes, so no, there is no requirement for employers to put in place a specific policy addressing the needs of those with caring responsibilities, particularly experiencing ongoing childcare problems. But we know that just under a third of employers have already done that and have specifically put in new policies in place that ensure line managers can support those with ongoing childcare difficulties, whether that's through flexible working, adjusting start and finish times and sort of core hours of business, whether it's helping those who need to work outside of the home, perhaps in a shop, whether it's about helping them to self-roster and set their own working patterns as much as possible because of the childcare difficulties that they're experiencing. But no, there is no compulsion on employers to do that. But we think that's a real area where reps could be bringing this to employers and saying, what are you doing to specifically support workers who are facing ongoing childcare difficulties? How can we make sure that their performance and attendance at work isn't negatively impacted? Can we talk to them for you? Can we bring together what they want to see? Can we bring that to you and have that put together in a policy that, you know, exists in a very temporary space, but there to make sure that those workers are able to continue working? They're not disproportionately disadvantaged because of the impact of COVID on childcare, and that they're not put at risk of losing their jobs or their performance being affected. So it would be really great if reps could be proactively bringing that to their employer. And I can put some links to some research that was done and published last week by the Global Institute for Women's Leadership that talked about some best practice in this area and what employers are doing. So I can share that in the link in a moment.
That would be great, Sian. Thank you. Yeah, and I think that's key advice that Sian just mentioned that can apply to so many situations. So talk to your members, talk to your colleagues, and then bring these issues to the table in discussions with management. It can apply to so many situations. I want to raise a question now for Quinn, please, that that's been posted. So the question asks, how do all of us activists make sure that our less able colleagues are not being just left to work at home when being in the workplace would be their preferred option? Have you got any advice on that, please, Quinn?
So, you know, I was really clear about the benefits of working from home that we're seeing. And I think that absolutely holds true. But the one thing I want to be clear about is also that we think that it should be the employee's choice. So if the disabled worker wants to go into work, then they, you know, and the government guidance at the time allows it, because it's never shifting film. They should be able to, you know, it should be the disabled worker's choice to work at home or not work at home. It shouldn't be a diktat from the employer, as long as they're still complying with government advice on how to protect people from COVID-19.
Sure, thank you, Quinn. Again, it comes down to communication, doesn't it? Talking to people and finding out what will best suit their needs and their situation. Another question for you, Sian. Right, let me just find it here. So it's about redundancy situations, and the question asks, however, as managers are also aware of the limitations when deciding who to make redundant or just not renew a contract for, the likelihood of finding the evidence to prove a case is low, except if another manager is willing to divulge this information. How else can a rep find the information that they might need prior to a decision being made?
That's yeah, it's a great point, and it's really difficult. Sometimes managers are so confident in themselves that they often don't hide their discriminatory views. So it could be something that actually they've said in a meeting that shows a discriminatory attitude towards pregnant or pregnant staff or those on maternity leave, and actually if other people have witnessed it, then they are important witnesses to a discriminatory attitude. And that goes, again, for anybody with any protected characteristics. There are other ways that you can collect evidence. And I'd say that if you are beginning to go through a redundancy process, then the employer must be talking to the reps in that workplace and showing what their process is for that selection criteria, making sure that it's fair and transparent, and bringing that to the reps, who are then informing and being informed and part of that redundancy process and its consultation. And within that, if an employer refuses to map who is being made redundant, it's something that reps in a workplace can do themselves, is be mapping out who's being made disproportionately redundant. Are there any patterns here? Can we see that actually it's predominantly younger women or it's disabled workers? You can map that yourselves to begin to collect your own evidence base. But what we really want is the employer to do that with the HR department and with their reps in the workplace, mapping that together before it gets to the point where people are being made redundant, and looking at, actually, has bias crept in here? Has discrimination crept in? Because we can see, once we've mapped out whose jobs are at risk, exactly the demographic of who that is, and understanding whether discrimination has come in. So I think it's really about holding employers to account here, making sure they are negotiating with reps and they are putting in place the mapping, having a fair, transparent process for who they are selecting and why, and then mapping out whose job's at risk, whether they have any protected characteristics, because that's when you'll start to see whether that discrimination has crept in. And then talking to your members, do you know that there are certain managers who hold discriminatory views? Have there been any evidence of that from before that would be useful to this? Did they 2 years ago? Were they involved in a grievance where they were discriminatory towards a pregnant member of staff or disabled member of staff? All of this will help to build up a picture if you are taking forward an individual claim of discrimination. That will help to build up a picture of actually there is a workplace culture of discrimination towards a group with protected characteristics. Hope that helps.
Yeah, it sure does. Thank you, Sian. So we've had quite a lot of questions, but I think we've got time for one more. I've tried to make questions quite general to answer as many people's queries as possible. Just one quick thing before I answer that. Sian mentioned mapping the workplace, and something has just appeared in the chat about mapping. We do include mapping guidance and resources in our reps training courses, in our health and safety courses, and our union rep stage 1. So please do check those out. You can take a look at the resources to help you with a mapping exercise. Hopefully a link will appear there shortly. Thank you, Alice and Ian. So the final question could perhaps be directed to both of you, but I'll direct it to Quinn first. So following a question about reasonable adjustment passports, is there a plan in place to encourage reps to talk to their members and managers to construct a COVID-19 adjustment plan for each member? Could that be something that we could consider? So what are your thoughts first, Quinn?
That's an interesting question. I think, one of the COVID-19 related things is, the risk assessment, and we all need to be doing risk assessments and also individual ones to assess individual risks, particularly for pregnant women who have their own concerns. So, and Sian, I'll do that to Sian to talk about. So I guess it's something, but I think, I would look at the risk assessments and what your employers are highlighted and try and make sure they have those done so you can see what the COVID-19 related risks are and how they're being mitigated. But I do want to take 1 second to see, there was a question in there also about reasonable adjustments more broadly. And I just want to be clear that the Equality Act 2010 is still the law. It is still in place. Employers still have a duty to make reasonable adjustments, and that duty does extend to the home. I'm going to pop a link into the chat right now to some guidance we released on that earlier. So Sian has a chance to address the question as well.
Yeah, thanks, Quinn. There were so many questions. I was trying to pick one that had the broadest appeal, so that's fantastic. So Sian, this interesting idea about a COVID-19 adjustment plan. Any thoughts? Is it something that we could encourage?
Oh, absolutely. I mean, it's what reps do day in, day out, is talk to their members, get a sense of what the issues are and bring that to management. And so I think it's brilliant to frame it in terms of a COVID-19, forward-looking action plan for what are the issues that you're experiencing, that our members are experiencing in the workplace. What support do they need from managers on an organisational level too? Quinn brings up a really important point around risk assessments. We surveyed over 3,400 pregnant women and new mums in June, and we found that less than half had a risk assessment during pregnancy since the crisis had begun. But even more crucially, 46% of those that had a risk assessment said their employer had taken no steps to reduce or remove the risks identified. And so again, if reps, and I know that they are because they're the ones bringing it to my door, if they're talking to their members, they know these are the issues in the workplace and they can set that together in a plan and take it to management. So I think it's absolutely great. And whether you do that through kind of town hall meetings where you keep in touch over Zoom, or whether you send something, there are lots of free websites where you can set up a very simple survey for members, and you can circulate that and get some of their feedback, kind of test what the pressure points are. And I would say, again, have a mind to Are staff on maternity leave? Are they on long-term sick? Are they currently furloughed? How do you engage with those members who may not be checking emails as regularly, but who are really important, because we know that those being on maternity leave, being on furlough, having a long-term health condition puts you at higher risk of discrimination. And so it's really important that those members that are perhaps the furthest away right now, that we're speaking to them and getting an accurate picture of what's going on for them. So great idea.
Thanks, Sian. So yeah, we thank you everybody for joining today. We've covered a huge amount of information and we've tried to answer like a lot of broad questions. So it's great to see that people in the chat panel are saying how useful it's been and sending their thanks to Quinn and Sian for today's session. Thank you everybody for joining. Like I said, we will be this session has been recorded, so we will be sending a link round to everybody who has opted into that, along with all the links of that have been shared in the chat panel. So we'll see you again for a webinar soon. You might want to, if you are interested in the webinars that the TUC is producing, do tune in to the next webinar from my colleagues in Union Learn. It's on October the 8th. It's part of their Festival of Learning, and it's all about empowering dyslexic learners. You can sign up to that and all other webinars from the TUC by going to crowdcast.io/TUC, and everything that's coming up is listed there. So we do hope to see you again soon. Have a good rest of the week, and bye-bye for now.